Hey guys, this is Dr. Samir Islam. I want to thank you for joining me today for my Facebook Live. So today we're going to end our series on colon cancer awareness, and tonight I want to speak to you about how you can make sure you do not die from colon cancer. Now, colon cancer is the second leading cause of cancer death in the United States, and the rates have been declining in older individuals. And we know for a fact that colonoscopy has saved lives. And so if you are due for a colonoscopy, which starts at the age of 50 years old, I would recommend to get screened for colon cancer. But even though colon cancer is the second leading cause of cancer death, I would argue it is probably the most preventable cancer that's out there by far. And there are multiple different ways that we can recommend so that you don't get cancer. And so today, I want to give you 6 tips I want you to know. And with these tips, you can prevent yourself from getting cancer. Now, tip number 1 is to make sure you eat lots of fruits, vegetables, and whole grains. We know that diets that have a lot of fruits, vegetables, and whole grains have been linked with a decreased risk of developing colon cancer. We also know for a fact that eating less red meat and processed meats those particular meats have an increased risk of developing not only colon cancer, but other cancers as well. So having a healthy diet, I would argue more for a plant-based diet, has been shown to be beneficial in multiple different factors, not only for decreasing the risk for colon cancer, but also decreasing the risk for heart disease and other GI complaints. So make sure you eat your veggies, eat your fruits, and have your whole grains, and minimize as much as you can the red meat and the processed meats that you may be eating. Tip number 2, get regular exercise. This is vastly important, not only for your overall health, but for your colon health as well. We know that exercise increases the amount of reactivity within the body to get rid of toxins. We also know that exercise helps to decrease the risk for other cancers besides colon cancer. But not only is it good for your colon, it's good for your heart, it's good for your lungs, and overall good for your health. And so even if you can just do a little bit of exercise every single day, that will make a huge difference in terms of getting your health better and decreasing risk for colon cancer. Tip number 3, watch your weight. This is extremely important. Obesity has been related to higher risk of developing precancerous polyps and cancer as well. So if there's one thing you can do to help out to decrease your risk for colon cancer and precancerous polyps, is to lose weight. Even a little bit of weight can make a huge difference, whether it's through exercise, diet, or the combination of the two. Any little pound loss will substantially increase your risk to not develop cancer within your colon. Step number 4, don't smoke. This is huge. If you smoke, you are not doing anything healthy at all for your health. You are causing multiple problems, not only in your colon, your lungs, your brain, your skin. Don't smoke. Smokers are most likely to die from cancer and get cancer, and they're more likely to die at a younger age. Do not smoke. Stop if you can. If you need help, we have healthcare providers who can give options to help out with you to stop your smoking habit. Tip number 5, limit alcohol. The American Cancer Society does recommend that men don't drink any more than 2 drinks per day and women don't drink any more than 1 drink per day. And a lot of questions that people ask me is, okay, what is a drink? What defines a drink? And here's what it is. A single drink amounts to a 12 ounce of beer, 5 ounces of wine, 1.5 ounces of 80 proof distilled spirits or hard liquor. If you do this, don't drink more than 2 drinks per day for men, and don't drink any more than 1 drink per day per women. In fact, if you can limit alcohol completely, this will make a big difference with your overall health as well. So make sure if you can't even eliminate alcohol, at least limit it to these guidelines, because if you do this, you are decreasing your risk for colon cancer. We know alcohol has significant effects not only for colon cancer, but hepatitis, liver cancer, cirrhosis, and other cancers within the body as well. And last but not least, the most important thing you can do right now to prevent colon cancer is to get screened. No matter what you do from 1 through 5, if you do not get screened, this is probably the best and easy way to prevent colon cancer by far. Now, I don't necessarily mean that you all have to get a colonoscopy. If you are a person who says, hey, I will never get a colonoscopy, I will never want one, I just don't want to deal with it, that's okay, that's fine. There are some people who have those who will not get a colonoscopy. There are other ways to get screened for colon cancer, whether it's with stool testing or other means. So make sure you speak to your healthcare provider to find a way to get screened. Not every screening test has to be a colonoscopy, though I would say the colonoscopy is the most effective test, but there are other tests we can do to get screened. But if you do these 6 things, this would substantially decrease your risk from getting colon cancer. And if you can implement this within your life, you would make a huge difference in preventing this deadly disease from occurring to you or your loved ones. I want to thank you guys for joining me today, and I will look forward to seeing you guys next week. Hope you have a good rest of the night. Thanks and take care.